On the chest X-ray, boot-shaped heart is seen in which cardiac condition? It's a tetralogy of Fallot. Inverted 3 sign or E sign is seen on chest X-ray because of which cardiac condition? It is coarctation of aorta. Mermaid syndrome or cyanomelia or caudal regression syndrome is associated with pre-existing diabetes mellitus in mother. Do you know the differential of the strawberry tongue, strawberry gingiva, strawberry gallbladder and strawberry vagina? There are many things in pediatrics which have a adjective as a strawberry. So to know the answer to this question, please watch the video till the end. Welcome back to my channel. In today's video, we are going to do rapid revision for many pediatric MCQ for INI CET. Do not skip anything. Watch till the end. Let's get started. Question number 1. 5-year-old child with rash, eczema, thrombocytopenia and recurrent sinopulmonary infection. What could be the probable diagnosis? Here there are 3 hints. It's a male child, boy, with rash, with thrombocytopenia, with recurrent infection. There are many clues which points toward the single condition among these 4 syndromes: Down syndromes, Noonan, William or Wiskotts Alderich Syndrome. Down syndrome, there are many facial dysmorphism which is not mentioned here. In Noonan also it is not there. William, there are also many dysmorphism which is also not described here. This all condition classically fit into one syndrome, that is Wiskotts Alderich Syndrome. What is Wiskotts Alderich Syndrome? You have to remember mnemonic water. Wiskotts Alderich stands for water. T stands for thrombocytopenia. E stands for eczema and R stands for recurrent bacterial infection. And this is a very classical picture of a boy presenting with thrombocytopenia as well as rashes with recurrent infection. So it's a triad of eczema, immunodeficiency and thrombocytopenia. So what is it and why it happens? It is X-linked recessive. X-linked recessive means it manifests in male and female will be carrier. It is genetic condition X-linked recessive in which there is a mutation in gene encoding VASP gene located at SP1123. Here IgG will be normal, IgM will be low. IgA and IgE would be elevated. So we have to remember the mnemonic. Chad's kinky wife got lucky. This is mnemonic to remember X-linked recessive disorder. Chad's kinky wife got lucky. So what are the other conditions with X-linked recessive? Chronic granulomatous disease, Hunter's disease, anhydrotic ectodermal dysplasia, dyskeratosis congenita, SCID, kinky, manky kinky hair disease, wife. W stands for Wiskotts Alderich, I stands for ichthyosis, F stands for Fabry's disease, E stands for Ehlers-Danlos syndrome, G stands for G6PD and Lesch-Nyhan syndrome. So this is a very easy mnemonic to remember X-linked recessive disorders. But how we are going to remember the serological pointers toward Wiskotts Alderich? We need to remember that after taking whiskey, ethyl alcohol goes up. So IgE and IgA will be increased, while IgM will be reduced and IgG will be normal. Mental orientation reduced, so M will be reduced and IgG will stay normal. Question number 2. Anomaly demonstrated in this image is associated with pre-existing diabetes mellitus, gestational diabetes mellitus, SE inhibitor and valproate used by mother in antenatal period. What this image is showing? You can see there is a fusion of lower extremity. This is called cyanomelia or caudal regression syndrome or mermaid syndrome. This mermaid syndrome or cyanomelia is associated with infant of diabetic. Boot-shaped heart is seen in TOF, TGA, coarctation and VSD. Here it is boot-shaped heart and it points toward tetralogy of Fallot. Here we need to remember the component of TOP. So there is easy mnemonic to remember VSDH. V stands for VSD. S stands for stenosis of pulmonary valve, but you need to remember these 2 adjectives properly. That is progressive infundibular pulmonary stenosis. It means the child will present with progressive, the site will be infundibular. It means that child will not present with cyanosis on the first day of life. It is progressive. So the presentation of this cyanosis will be later in the life. Cyanosis presentation on the first day of the life in the newborn period. The first and foremost thing should come in a mind is TGA. D stands for overriding of aorta. Here D stands for overriding of aorta. H stands for hypertrophy of right ventricular, because there is a stenosis of pulmonary valve. Right ventricle has to work against the obstruction, so there will be hypertrophy of right ventricle. Progressive pulmonary stenosis, so baby will present late. Day 1, the very important differential diagnosis would be TGA. The next question is adult person with borderline hypertension with following X-ray showing. Here it is 3 sign or inverted E sign. What could be the diagnosis? TGA, TOF, coarctation of aorta, or none of the above? There are two important things pointed here. One is a notching of rib, as well as there is a 3 sign. So this is seen with the coarctation of the aorta. What is happening in the coarctation of the aorta? In the coarctation of the aorta, there is issue with the aorta. It means there is somewhere obstruction. So in the upper part there will be over congestion, in the lower limb there will be a less blood supply. So after some time there will be a formation of the collateral, and this collateral will pass from the inferior margin of the rib. So there will be a notching of the rib. Inferior margin of the rib will have a notching. So two important markers on the X-ray would be 1, 3 sign, as well as notching of inferior margin of ribs. These are the notching. One more important thing would be there would be a bounding upper limb pulse, feeble lower limb pulse, as well as notching in the ribs. Question number 5. This neonate is suffering from omphalocele, gastrochisis, umbilical hernia, or volvulus. What could be the answer? Here we can see the content of the abdomen is herniated out and there is no sac. So it points toward the gastrochisis. It is abdominal wall defect. Abdominal content is out, but there is no sac. Now on the contrary, this neonate is suffering from, here also abdominal content is out. It doesn't look like intestine. Here it is probably kidney and liver. So, and there is a content, it is covered with sac. So is it omphalocele, gastrochisis, umbilical hernia, or volvulus? It is omphalocele. The content of the abdomen, it is also abdominal wall defect, but content of the abdomen will be covered properly by sac. Now very important thing related to strawberries. Strawberry tongue is seen in which condition? Kawasaki disease as well as scarlet disease. Kawasaki's disease is medium cell vasculitis, while strawberry gingiva is seen vaginal granulomatous, which is small vessel vasculitis. Strawberry gallbladder is seen in cholesterolosis, and strawberry vagina is seen fungal infection, that is trichomoniasis. Strawberry shaped skull is seen on antenatal USG in trisomy 18, while strawberry shaped scrotum is seen multiple sebaceous cyst. Question number 7. A child with hypercalcemia with supravalvular aortic stenosis with typical facial features like elfin face, broad smile, and gregarious personality. It means outstanding personality. What could be the probable diagnosis? Down, Noonan, William, or Wiskotts Alderich? We know it is not a Wiskotts Alderich because there was no mention of any kind of eczema, immunodeficiency, of thrombocytopenia. These features are not definitely suggestive of Down or Noonan. So we are left with the only one option, that is Williams syndrome. But this is classical presentation of Williams syndrome. It's elfin face. Look at the smile of the elf. And look at the smile of this child. There will be a broad smile, hypercalcemia, as well as supravalvular aortic stenosis. Next question. What is this tool and it is used for? This tool is called Shakir's tape. It is used for mid-upper arm circumference. The mid-upper arm circumference should be taken between the olecranon process of the ulna and acromion process of the scapula. The midpoint is taken, and if it is red, it means it is severe malnutrition. Yellow means moderate malnutrition. Green means child is normal. A 6-year-old girl can climb upstairs with alternate leg, knows her name, age and gender, but cannot narrate story. What is her actual age? Here we need to see a 6-year-old child cannot narrate story. A narrating story would come by the age of 4 years. So this child or this scenario is showing that this baby is having delayed milestone, but what is her actual age? We need to remember this story for it, that tree is rhyming with number 3. So at the age of 3, a boy can climb up and he is waving his hand. It means, and tells his name. It means that at the age of 3, child can climb upstairs with an alternate feet. Handedness is developed by the age of 3, as well as child will know his name, age and gender by the age of 3. So these are all things which should be done by the child who is 3 years old. But by the age of 4 years, child should narrate the story. So here the correct answer is option B, 3 years, because 4 years is out. By 4 years, child will be able to sing poem and stories. 2 years is also out because 2 years all this will not be seen. 5 years the child should narrate the story, and there should be another thing which child should be doing which is not mentioned here. So correct answer is option B, 3 years. A 3 years old child is called having delayed milestone if he is not able to do one of the following. A 3 years old child should be doing what? Now hop on a feet. 4 is having support of one limb. This is called hopping. So hopping will be developed at the age of 4 year, while skipping, that is jumping on both the limb, that is developed at the age of 5 years. Uses spoon effectively. Now we all know that by the age of 18 months to 24 months, child should learn how to feed himself without spillage. So by the 2 years, child should know how to use spoon effectively. So yes, this is correct. Now copy a square. If you remember drawing skill, by the age of 1.5 year, child know how to scribble. By the age of 2, child is able to draw the line. By the age of 3, circle should be there. By the age of 4 or 4.5, child should be able to draw the square as well as cross. By the age of 5, triangle, and by the age of 7 years, child would be able to draw the diamond. So according to this, the square should come by the age of 4 years. So it's not called delayed. So the correct answer to this question is use spoon effectively. That's all for the today's MCQs. I hope you all understood and learnt well. Let me know what else you would like to learn.